Did you know you could test if a kid was a psychopath? Well, kind of. We have tests that look at the same traits that, on the right trajectory, turn into an adult psychopath, or the wrong trajectory. Lack of empathy, absence of guilt or remorse, shallow affect, superficial emotions, unconcern about their performance, manipulative or deceitful. Do you know when you can start to see these? At age 3. In psychology, we have 4 main assessment tools. Inventory of callous and unemotional traits. You can do the test at age 4. Antisocial process screening. You can start it at 6. Child problematic traits. You start at 3. Psychopathy checklist youth version. You start at 12. Studies have shown that there are precursors to psychopathy in kids as young as age 3, 4, and 5. The most common ones are persistent aggression, especially towards peers and animals. Limited emotional responsiveness, indifference about punishment, instrumental cold aggression rather than reactive anger. They're not throwing fucking tantrums. It's important to note that environment can shift this. Parental warmth can make it better. Authoritarian parents can make it worse. Early intervention is always the best choice. It literally takes a village, and don't be ignorant about that. We even see brain differences in these children. They have lower amygdala activity, which means that they're not feeling emotions the same way other kids are feeling them. They might not be feeling them at all unless something is extremely overly stimulating, like cutting open a squirrel and dissecting its organs at 4 years old. They don't have moral reasoning. That comes from the ventral medial prefrontal cortex. And their reward processing system is off. They don't react to punishment how they should, and they don't react to rewards like most of the other kids. They're based on functional MRIs. Now, don't go over diagnosing your child. If you're curious about this, educate yourself and consult a professional before you diagnose your child. There are early intervention approaches. It doesn't have to be Dexter. Parent-child interaction therapy, multi-systemic therapy, cognitive behavioral therapy, emotion-focused therapy, trying to teach them emotions, see if they have any there, draw them out, encourage them. Modeling empathy and moral reasoning. They respond well to reward-based systems, not consequence-based when they're children. Like I always say, if you chose to have a kid, you better parent. Understanding the personality and the mind of your child is a part of parenting.